Hi, I'm Dr. Randy Roberts, creator of the 3-on-6 full mouth dental implant treatment, and I am going to review a video that compares the All-on-4 with the 3-on-6 done by Dr. GursSehmi. So here we go.
Implant system and an all-on-4 implant system. Okay, so just to bring everyone up to date, both of these solutions are designed for people who have got no teeth, or they're in a situation where they've got very bad teeth and they will need to be removed. An all-on-4 kind of system, okay, and I'm going to say kind of system because all-on-4 is specific product made by Nobel Biocare, which is a really well-established implant company. So an all-on-4 kind of system is where you typically take 4 implants and you put 2 at the front, 2 at the back, and the back ones are angled. Okay, so I'll explain why they're angled in a minute. And then on 4 implants, you have a full set of teeth made. Now, typically, this full set of teeth has gum on it, fake gum. Okay, so your natural gum is flat and is higher up. It's higher than your lip is covering, and then you have the fake gum, which is a little bit visible, and then you have your teeth on there. Okay, and this, in my opinion, has a lot of advantages doing it like that. The 3-on-6 system is slightly different. So you would have 6 implants placed for the full set of teeth. And then on those 6 implants, you then have 3 individual bridges made, okay? And on their website, they've got a lovely diagram explaining how this is done. But one of their unique selling points is that there is no fake gum, okay? So I'll come on to why I think this is a bit of an issue in a minute. Now, both of these are products, okay, and that both of these are examples of people trying to productize a treatment, right, a medical treatment. Typically, what would happen is, you have a problem, or somebody has a problem, they come in to see someone who can fix that problem. So if I had a leaking pipe, I would call a plumber who would come in, look at the problem, diagnose it, see why it's leaking, see what the problem with the system is, and then take corrective steps to fix that. Okay, but here what's kind of happening, and this is a general trend in medicine, is that people are self-diagnosing at home and then thinking, oh, you know what, I really need this all-on-4 treatment or this 3-on-6 treatment. Then they go online and they find an all-on-4 or 3-on-6 provider, and this can be a little bit dangerous because I would say about 2 people who come to see me every month, not in lockdown obviously, but they come and see me and they're convinced that they want to have all-on-4 treatment, and they generally dislike it when I say, actually, you know what, we can save what you've got.
So I'm going to pause him right there to agree with everything that he said so far. The All-on-4 is a treatment modality that was made to treat people that wanted to replace all of their teeth and do a full mouth of restorations. And the 3-on-6 was made as a competitor to that, because when I saw people who needed a full mouth of implants, that the only option was the All-on-4. For me, that was horrendous, because I saw that in order to be able to do the All-on-4, that you needed to remove a huge amount of gums in order to put dentures in people's mouths. And I was completely unwilling to do that. Why would I remove a patient's healthy bone and gum tissue when they had that? And so, but that's what people were doing. They were just removing a great amount of bone and tissue, which is just destructive and harmful. And like you were saying, patients are self-diagnosing and they're saying, I've got some bad teeth, and so I saw the All-on-4 with some before and afters, and so I think I should just pull all of my teeth. And I think that is a problem. And that's often people will fly to me from around the country and they're saying, I want the 3-on-6, and then they'll get in my chair, and often, because we'll do a consultation online, and oftentimes I'll say, you know what, you are a great candidate for the 3-on-6 based on the amount of bone and gum tissue that you have, that we could make that look beautiful. However, you have still you still have some great teeth in your mouth. And so we don't necessarily recommend pulling out all of those teeth because those are salvageable. If your main concern is that you want to have beautiful teeth, we can still give you beautiful looking teeth with veneers or with crowns or with composite buildup without having to remove any of your teeth at all. So one of the great advantages of going to somebody who knows how to do the 3-on-6 is that you can go to a 3-on-6 provider, and we're not a one size fits all. It's not that, okay, now since I know how to do the 3-on-6, no matter what your problem is, I'm going to make you do a 3-on-6, which I feel like a lot of the All-on-4 providers are. So if you go into a lot of these different All-on-4 providers, they'll say, I want a new smile, and they'll say, okay, perfect. We're going to chop out all of your teeth and all of your bone, and we're going to put in some dentures with On-4 implants. 3-on-6 providers are experts at preserving your bone and your gum tissue and being able to also preserve your teeth when possible and just do implants in the places where they are needed so that we are giving you choices for the future. If at some point your teeth or implants or something has a problem, you still have all of that bone. With the All-on-4 treatment, you're chopping away that bone and that gum tissue. You've removed so many of your options for the future. Also, they're significantly more difficult to clean and maintain. So just a lot of reasons why I prefer that if people are considering doing a full mouth treatment, you go to somebody who knows how to do everything, not just a one size fits all, so that you can make sure that you get the best treatment. All right, we'll keep going.
But that aside, right, the whole thinking behind an All-on-4 or the 3-on-6 is nothing new, okay? These are treatment possibilities which have been around for a very long time. But what these companies have done is just put a label on it and selling it as their own thing.
So I'm going to disagree a little bit with that because the All-on-4 has been around for a long time. And doing segmented bridges has been around for a long time. But the way that these companies, including us, we've figured out ways to make the process much more effective and better and stronger. The materials are better, the implant systems are better. So different companies are going to have different processes and different looking results, and different doctors are going to have different results based on, some doctors. If you're going out there, you want to go and find a doctor that you say, I like the way that this doctor handles himself, and I like the way that his results look. I like that he was able to take somebody from here to there, and I've seen that he can do that consistently. So that's something that you need to be researching, not just the company, but the doctor specifically, to make sure that you're comfortable with that person. Because with the 3-on-6, this isn't just segmented bridges. We have been working on this process for over a decade now. And since then, we've learned so many things that were wrong about just doing a segmented bridge in the past to now that we can develop people's tissues and bone to make it look beautiful and perfect. And that's not something that you just get on your first try. And that's not something you get without really extensive education on knowing how to do things beautifully. So the processes that we have are a decade in the process of learning, and so valuable to give people the best aesthetic and functional result. All right, I'll keep going.
Okay, so the 3-on-6 having implant bridges has been done for forever and a day, and all they've done here is said, okay, you know what, instead of having one long bridge, let's make 3 separate bridges.
Like I said, not correct. We do so much more than just give bridges. I mean, if you go to somewhere that someone says, yeah, we can put bridges in there, yeah, they can. Somebody can go in there and put implants and put bridges in there. But the process of developing your tissues and making everything thin and narrow and functional and actually aesthetic at the same time is one of the most difficult procedures to do in dentistry. It requires the most difficult parts of oral surgery, prosthodontics, and periodontics, which are 3 different specialties all mixed into one procedure. And so doctors go to school for many years to become an oral surgeon, to become a periodontist, and to become a prosthodontist. And so to be able to take the most difficult parts of those procedures, of those doctors that have gone to school for so many years, and merge it into one procedure is very complex. And to say all it is bridges, That's true. It is just bridges. But if you go to a 3-on-6 provider, you're not just getting bridges. You're getting bridges that are going to adapt into your gums, that are going to adhere to your gums so that they look like natural teeth coming out of your gums, and so that they actually attach to your gums so that food can't get underneath there, and that look and feel just like your teeth. So these aren't the type of things that you get from anybody, but this is what you get when you go to a 3-on-6 trained provider.
Okay, and their website is very pretty. You know, it really explains the process pretty well. They don't have that many before and afters. Okay, they got a couple, because nobody would sign up if there was no before and afters. You have to sell them.
We've got a lot more now. This video looks like it was a few years ago.
The process, I'm going to go through the process, and there's some elements here which I do strongly agree with, which are really, really good. Okay, you have a consultation first of all, that makes sense. Have the implant surgery, at which point you will have a removable denture. Okay, as a temporary measure. So this is a key difference. With the All-on-4, typically you don't walk out with a removable denture while the implants are healing. Okay, but they say if it's suitable...
You do not walk out with the removable denture. That must be from our website a while ago. What we do, because that's one of the most important parts of the procedure that we have learned as we've developed, is that we are putting in immediate teeth, and those are developing your tissues throughout the process of the 3 months while you're healing. So it's not removable. You have fixed teeth that are one solid piece. So when you get the surgery, you don't have 3 separate bridges at first. You have one solid piece so that the implants can all support each other. And so you leave the day of the surgery with a beautiful, functional smile that you can chew soft foods with, that is not removable. That you should be very, very happy with.
Can have a full arch temporary bridge, which is what you would walk out with an All-on-4 treatment. Okay, and then they say step 3 is they'll make what I call in my clinic a trial smile, so a smile made out of temporary materials, which I 100% recommend. You know, this is a really good way of doing it. And then once you're happy with the aesthetics and the bite, you have it processed in porcelain. Okay, and that's where you make the 3 porcelain bridges. Then you have the final bridges made.
So we have our consultation, we have the surgery where you get your first set of teeth, and then you'll come back the next day after that, and then we can make slight adjustments to that to make sure that we're giving you the beautiful smile that you want to have right from the bat. And then you have that smile for 3 months, and then after 3 months you'll come back and we'll remove those teeth and we'll take a new scan and we'll give you another set of temporary teeth, making all the little adjustments that you would like to have towards moving towards your final teeth. And then you have those for another day to make sure that you are happy with how they look and how they feel and how they function. And then after that we'll go to make your final teeth.
Then, if we scroll down to the features part on the website, and these features tables, right, they're so common, you'll see them on so many websites. My biggest problem is the questions which they ask are heavily skewed towards the system that they're trying to promote, okay? So here is... if you look at the All-on-4 column versus the 3-on-6 column, you'll see they're very similar, okay? But it says here that the 3-on-6 never needs to be removed by a dentist, okay? I would completely disagree with this. If I've got a patient who's got a bridge, an implant bridge, okay, especially if it's a screw-retained implant bridge, which is easy to remove, and all the All-on-4 ones are all screw-retained, then I would recommend removing it, inspecting the implants periodically, maybe once a year, once 2 years, and then putting it back, okay?
The reason that he recommends that is because with the All-on-4, normally you get so much food and gook and crap that gets underneath there because it's so difficult to clean underneath there, especially the traditional way of doing the All-on-4s with the acrylic. The zirconia All-on-4s, which we will sometimes do, you're able to make that a lot narrower at the gum tissue and much more cleansable. And don't get me wrong, we do the All-on-4 sometimes, but when we do the All-on-4, it's because that bone has already been lost. We're not chopping away bone to create space for an All-on-4. We're doing All-on-4 because that bone is already lost. When there's bone there, we we use that bone and we build it up for the 3-on-6. And we have found that with the 3-on-6, the way that we develop the tissues, the teeth actually, and the tissue actually grabs onto the teeth so that there's a connection between the two where food can't get in there and you can't even floss underneath there. So you water floss there, and if we ever do need to remove the teeth, we're actually destroying that connection between the teeth and the gum tissue. So we don't want to destroy that connection. We love having that connection between your teeth and your gums because that helps you to maintain healthy implants. If food and if the tissue is attaching to your teeth, then food's not going to be able to get in there. You're going to have healthy, strong teeth and healthy implants. So disagree with him disagreeing with that these teeth don't need to be removed, because they do not need to be removed.
So even if you've got 3 individual bridges, I would still recommend to remove it and have it. And then feels and functions like natural teeth. No implant is going to feel exactly like a natural tooth. There's a couple of very, I wouldn't say big differences, okay? Because the patients who have All-on-4, they say that, you know, it all feels really nice and feels really natural. And I assume that the people who have the 3-on-6 or whatever you're selling, you know, full arch implant system, they're going to say that it feels natural because it will feel much more natural than the situation that they've just come out of.
It feels much more natural than an All-on-4, because with an All-on-4 you have a big old clunky piece of something in your mouth where you've got teeth and then fake gum material. And normally with an All-on-4, you have to have a certain amount of thickness in order to be able to prevent that from breaking. With the 3-on-6, we're able to create teeth that are just the size of your teeth. So it feels more natural because it's the size of your natural teeth. Is it not exactly the same as having an individual tooth? Yeah, it's not exactly the same, but it feels way more natural than having a denture attached to 4 implants in your mouth.
But natural teeth have a little ligament, they've got a little bit of movement, whereas implants have no movement, they are solidly anchored into bone.
And that is another difference between the 3-on-6 and the All-on-4. Because it's segmented into 3 bridges, those 3 bridges each have a little bit of movement. Whereas with the All-on-4, that is one solid piece and the whole thing doesn't move at all. So having 3 bridges has a little bit more of a natural feel because each bridge can move a tiny bit. And so it just feels more like having natural teeth because it's not completely fixed and solid like an All-on-4 is, or an All-on-X.
Okay, they say that it's smaller and thinner as well. Again, I would disagree with this. You know, the All-on-4 bar with all of the teeth on it can be made to be very, very thin and pretty much as thin as as a bridge on implants, which
a bar with acrylic on it is as thin as porcelain all by itself. That doesn't make sense to me. You can make porcelain obviously as thin as you want, and if you're normally your bone is shaped kind of coming up like this, and the lower down you have to chop off your bone, the more of that you have to replace. With us not chopping away any of the bone, we're only replacing the top part of where the tooth was, and not replacing the tooth and the gum part, which is going to be significantly wider. So yeah, the 3-on-6 is significantly narrower than an All-on-4 is.
You know, again, we do that quite a lot in the right kind of situation. And then, you know, they don't give any idea on pricing. They've got all this stuff, all these questions which they answer, the FAQs at the bottom. And it says the All-on-4 is a larger, bulkier thing, feels unnatural. I would completely disagree with this. For all the patients who we do this for, we make it as thin as possible. And I've never had a patient complain that the final set of teeth is too thick. Okay, they do.
And that's awesome for them. There are some doctors that are great at making the All-on-4 and the All-on-X narrow, and we make sure that we do that as well. Whenever we do have to do the All-on-4, we want to make it feel as natural as possible, and we use zirconia so that we can get it as narrow as possible without having to use, if you're using a titanium bar with acrylic, normally that is going to be a bit thicker. So doing it out of solid zirconia makes it so that we can make it significantly narrower.
Sometimes patients will complain that the temporaries feel thick and they interfere with speech and things like that. That's normal because the temporaries are made from plastic. Plastic needs to be thick to give it a little bit of strength. Okay, so all-on-4, like, yeah, okay, this system seems suitable, okay, and I would always judge a system on, does it transform the patient's life? Okay, really, it doesn't matter what brand or what what you have. I would always say have good quality implants, but it doesn't matter whether you go 3-on-6, all-on-4, whatever, as long as it transforms your life and it takes you from a position where you're not able to eat, or you feel really self-conscious about the way your teeth look, and it takes you from there and takes you to a place where you feel really great about your smile. You don't need to worry about covering it up.
I agree with that. I agree that it's important to take your patient from where they are to a better place. However, I had a patient that came into me today who had the All-on-4 done just a couple months ago, 2 or 3 months ago, and it was just in tears because she wasn't aware that they were going to be removing her bone and her healthy gum tissue. And so her face now had shrunken in a little bit from that bone that had been removed, and it didn't feel natural like she had expected that it would. And now she has to pay for the procedure twice because we have to remove the implants that they did, and we have to do bone grafting and build everything up again because of how it was done. And that wasn't a transformation that she wanted. Did it look good? It looks fine. But was it something that she was expecting? And is she happy with it? No. So I was frustrated that she had to go through that. And she'd actually been looking into getting this done beforehand, getting the 3-on-6 done, and somebody had persuaded her to not. And so she was just so devastated when she found out that they actually did chop away her bone and did chop away her gum tissues and put that more clunky restoration inside of her mouth instead of just putting teeth in her mouth.
You can eat whatever you want, and when you go to a restaurant, okay, it doesn't matter whether you have 3-on-6 or all-on-4 or whatever it is. My slight issue with this system is the fact that they advocate no gums. Okay, now the reason for this is I'm coming very much from an aesthetic background, okay, and in order to create a beautiful smile, one of the key things that we have to get right is how much top tooth is on show when the patient is talking. Okay, so we can judge this. Sometimes we'll ask the patient to say the letter M and let their lips just rest, and then we take a photo and then we take a measurement of that and the amount of tooth. Okay, so that dictates how long the teeth should be. And then we have what we call our height-width ratio. So the width of a central incisor, the front tooth right in the middle, the biggest one, the width of it should be about 75 to 80% of the height of the tooth. Okay, and then once you've got all the teeth in position, the height is typically about 11 millimeters. So that dictates how high the tooth should be. Okay, so remember on the 3-on-6, all you've got is the teeth sitting on gum. Now, when you have teeth removed, you lose gum, okay, which means your implants have to be placed higher up. And not only do you lose gum,
So aesthetics is so important, and phonetics is so important. And one of the problems with like this person that just came in today, they're kind of like a one-size-fits-all. It's like, we're going to chop out your bone and we're going to put a denture in there and an all-on-4. And they didn't take into account where her teeth were previously, and they didn't take into account trying to get them to the same spot and trying to make sure that she was going to have the same function and speech. And so when you don't remove that bone and you don't remove that gum tissue, it's so much easier to get the teeth to the right spot, because you're just replacing the teeth. You're not having to replace the teeth and the bone and the gum tissue. And I guess it's not saying that it's so much easier. In my brain it is, but it's just right now with the patient coming into my office with now I don't know where her teeth were, because we've got this denture in there, and it's frustrating. He's going off of the aesthetic based on these things, not based on what the patient had. And we want to make sure that we're making everything look good, and we can take where they're at and make slight changes to from where they're at. Like if they've ground away their teeth, we're going to make them a little bit longer. Or if they have crooked teeth, we're going to make them straighter. We're not going to chop away all of your bone and your gum tissue and then start from nothing. We're going to start from where you're at, and we're going to make slight improvements to that.
When you have teeth removed, you lose gum, okay? Which means your implants have to be placed higher up. And not only do you lose gum, you definitely lose what we call the papillae. The papillae is the pink triangles between...
Now, you don't lose your gum and you don't you lose your papilla if you're doing the surgery correctly. And that's one of the important things why you go to a 3-on-6 trained provider, because 3-on-6 trained providers know how to maintain that papilla, and they know how to maintain your gums. They know how to make that look beautiful throughout the process. Hopefully we'll have some beautiful pictures of gums and papilla here with this video, so that we can show you, yeah, when you go to somebody who knows what they're doing and knows how to do all of the treatment options, knows how to do the 3-on-6, the All-on-4, and to do crowns and to do veneers, that person's going to help you have the best and most beautiful outcome, because they have all of the tools. They have the knowledge to be able to give you the best result. But yeah, I could understand with somebody that doesn't know that this is possible to have these beautiful papillas, that you'd say, yeah, I disagree with this because I don't know how that's possible. It's like, yeah, I get that you don't know how that's possible because you haven't been trained by us yet. And I recommend you come and get trained so that you can be a 3-on-6 provider. We need one in England. So anyways, come and get trained, and let's move on.
Gums. Every single full arch case which I've seen done without any pink gum has always compromised the aesthetics, because they to minimize this pink triangle, which is what you have to do, you have to flatten the gums really, to make it look okay. What they do is make the teeth look more square. Okay, so in between each tooth you have a contact area. Now that contact area, or a contact point as it is in perfect health, it needs to be about 5 millimeters from the gum. Okay, and then we know we're going to get this sort of pink triangle fill in. But if you don't have any teeth there, then that distance becomes a lot smaller, which means if you have two implants next to each other, it's going to be very difficult to get that pink gum looking natural there. So what you do is you make the teeth look more rectangular than oval, and that will hide this pink triangle below the lips. Okay, so if you look at all of the All-on-6 photos that we've got here, none of the cases will show that pink gum. Okay, and that is important, because sometimes when my patients laugh, freely, not just smile, but
there are cases that show that pink gum on our website now. This was an old one. There'll be several pictures on there that are showing beautiful, our natural gum lines in there that we can get for you.
Really laugh, you can see that high up, and from an aesthetic point of view, I always think it's nice to get that looking really good as well. Okay,
but also a lot of people don't show that gum, and so some people, even when their teeth are longer than 11 millimeters, they still maybe don't want to have that fake gum line on there because it's easier to clean and take care of. So I think that should be an option for patients. If you don't want to have that fake gum line and you don't want to have your bone chopped away, even if you do have a little bit longer teeth sometimes and it's not going to show when you smile, that should be an option for patients instead of chopping away the bone, putting a denture up in there. It's like, you don't need to have perfect plastic gums if they're never seen.
Best way that we found to do that is to add gum onto the teeth. Now, I don't want to be kind of saying one system's better than the other. I don't even use All-on-4. In fact, I did a bit of research on this 3-on-6 thing, and they actually use the same implants that I use 80 to 90% of the time. Okay, so there's no problems in the types of implants which are used here. There's no problems with the overall result, right? If it transforms the patient's life, that's excellent. I do have a slight issue with productizing dentistry like this, okay, because it's now a case where patients call up, and this has happened with orthodontics, with Invisalign and things. Patients call up saying, hey, look, can I have All-on-4? Can I have 3-on-6? Or do you do 3-on-6? Do you do All-on-4? There used to be a time where it would be like, okay, look, I've got this problem. What are my options? How can I fix this? Okay, and that's kind of the way that I still work. And I know that
Yeah, and I understand that because there are a lot of patients, like I said before, they're like, I want the 3-on-6, but they are maybe still candidates to maintain their teeth. But that's why what I'm saying, it's best to go to somebody who knows how to do all of the best options for you. So I'm happy when patients are saying, I want the 3-on-6, or at least somebody that knows how to do the 3-on-6, so that whoever's giving me the options knows how to do all of the options. And so I think it's very important for doctors that are performing the All-on-4 or the All-on-X that they know how to do the 3-on-6, so they know which patients are candidates. Almost all of my patients have gone to somebody else beforehand for an All-on-4 consultation who said, you are not a candidate for the 3-on-6 because you do not have enough bone and you do not have enough gum tissue. And I've heard that from several other providers that are well-known providers that say, no, they're not FP1 or they're not 3-on-6 candidates. And I to them would say, you don't know. You don't know who is until you've come and taken our course, because we've turned so many more of those patients into 3-on-6 than like 85, 90% of all of my patients, I'm able to get them into the 3-on-6, whereas they would be the opposite end, and they'd say, no, maybe 5% of my patients would be a 3-on-6, and the other 95% would be All-on-4. And like I said, it's because they don't know. And they're probably most, like 99% of the time, doing the All-on-4s, even on the ones that they think could be the 3-on-6. Which is why I love when a provider comes to get trained, because they're like, you know what? I chopped away that bone on somebody and I felt horrible doing it. I wanted to learn how to preserve that bone and how to preserve that gum tissue. And so it makes me really happy whenever I have doctors coming to our training course so that we can train them how to make beautiful, aesthetic, functional restorations, preserving all of that bone and all of that gum tissue.
Put off a couple of patients every month who come in wanting All-on-4, and I know there's a better way. So I tell them that. So yeah, they hear my opinion, but very few of those guys actually come back for treatment. Okay, so I hope this has been useful. If you've got questions, comments, you can always put them below. I do read all the comments and I try to respond to as many as I can. Okay, so until next time, take care. Hey guys, okay, so I recorded that whole video and I forgot to mention the issue with the very back implants. So the reason on an All-on-4 kind of treatment, the back implants are angled forward. So the top ones are tipped forward like that, and the lower ones, instead of being straight down, are tipped forward like that. The reason for doing this is to avoid things like the air sinus at the top. Okay, so when you lose all of your teeth, your air sinus expands, and in order to get your teeth as far back as possible, the back implants need to be tilted forward. Now, you can have implants going straight up, but you need to have what we call a sinus lift done first to do that. So I assume that with this 3-on-6, they're either using a sinus lift or maybe even something called a pterygoid implant, which is an implant which goes much further back. On the lower jaw, there's the nerve which we need to avoid. Okay, so there's a nerve which runs inside the middle of the jawbone. It goes all the way down and it comes out around here, kind of like midpoint where your corner of your lip is. It comes out there. So again, with the All-on-4, we're angling the implant, sort of the bottom of the implant forward, so that we're avoiding this nerve. Now, if you want to put your implants further back, sometimes you can do it if there's still enough bone there, but you need to use much shorter implants to do that. So Again, I'm just comparing and contrasting this 3-on-6 versus the All-on-4. All right, take care.
So yeah, so normally with the 3-on-6, we will use those angled implants to avoid the sinus on the front side for a 3-on-6. We also do the 4-on-8. He said that the pterygoid implants, normally those are on the back side. So if we're doing a 4-on-8 and we want to get a couple more teeth in there on the top, then we'll do those pterygoid implants and we'll go to the back side of the sinus. Normally we're not doing the sinus lifts, but we can do them when they're needed. It does slow down the treatment quite a bit, so we try to avoid doing the sinus lifts most of the time. And on the bottom, it's the same. 3-on-6, we're gonna get you 12 teeth. 4-on-8, we're gonna get you 14 teeth per arch. So, Dr. Sehmi, thank you for doing this review of the All-on-4 versus the 3-on-6. And appreciate you guys watching the video. If you have any questions, feel free to comment below, and we'll be happy to answer your questions. Thank you.